Continuing this conversation on pandemic preparedness, we're now going to narrow in on the role of data and AI in strengthening health systems. I'm Catherine Cheney. I'm a senior reporter at Devex, and I'm thrilled to be joined by Aerts, who's head of the Novartis Foundation. And I know one of your big messages right now is that COVID really makes it clear we need to transform our health systems from being reactive to proactive, predictive, and eventually preventative. And also that low and middle income countries, which has been a focus of yours throughout your career, have the most to gain as well as the most to lose when it comes to AI. So we'll explore some of these themes in a conversation on the role of data in health systems, strengthening for pandemic preparedness. So Anne, my first question for you is why this is such a turning point. You know, you've said that while COVID-19 has had a devastating human health impact, it can be a turning point when it comes to how we use data and AI in health. So how is that already happening?
Yeah, it's really true that it's already happening, because I feel COVID has been really the first epidemic ever that has been so data-driven. In fact, we use data throughout the way we try to control it, and hopefully we'll soon recover from it as well. We use it, for example, for contact tracing, but also for making real public health decisions that can have the impact on the largest number of people. So data is an essential part of the response to COVID, and that's how I see that it can really change the way we look at our health systems as well. It's been used massively also to diagnose COVID, and one example is an AI-driven diagnostic with lung images based on X-rays and CT scans that we developed together with our partners in Sao Paulo in the University Hospital of Sao Paulo, which is the largest hospital in Latin America with really a huge data lake of patients. And we developed a locally tailor-made diagnostic based on AI for lung COVID patients. And that has been tremendously useful for the diagnosis, or making it faster and more accurate for tens and tens of thousands of patients across different hospitals in Brazil. But in fact, the worst thing now is that we face a syndemic. We are seeing these conversions of COVID together with the pre-existing epidemic of non-communicable or chronic diseases, such as heart disease, diabetes, or cancers. And we see that COVID patients were even, or patients with such chronic diseases, were even worse off with COVID than other patients. So that convergence of these two diseases, and then the interaction of that convergence with the socioeconomic living conditions of people that were made much more visible during the COVID pandemic, and all these inequities that were pre-existing became really flagrant during the pandemic. And this is an even more urgent alarm bell for addressing the fact that our health systems are insufficiently ready to look at such a complex syndemic. And we need to transform or re-engineer our health system from being that reactive care system waiting for people to get sick and come and address them when they have a disease, to become proactive, predictive, and even preventative, so that they become real health systems that keep people healthy.
Absolutely. Well, you mentioned this syndemic and cardiovascular health being a key example of, you know, something where we've seen a really devastating secondary effect, knock-on effect from the COVID-19 pandemic, and yet also an opportunity. So can you zoom in on cardiovascular health in particular and talk about how data and AI can help us reimagine that space moving forward?
Yeah, I will take the example of the approach we have taken in urban cardiovascular population health across the world, in cities in Latin America, Africa, and Asia. We took an approach which is very comprehensive and is called cardio, and every letter in the word cardio stands for something. So the C is quality of care, the A is early access to diagnosis and treatment, the R is reform, policy reforms with proven impact on health, and the D stands for data and digital. While the I is intersectoral collaboration, also something that is absolutely necessary, not only between the health and the tech sector, but also between agriculture, education, transport sectors, because these have a bigger impact on the health of populations very often than the health sector alone. And the O of cardio, the last letter, is the most important one, that every undertaking or initiative on population health has to be owned by the local authorities and driven by them. So that's an example. We have applied that in Sao Paulo again, or in Dakar, the capital city of Senegal. And we've shown that with that comprehensive approach where every pillar is underpinned by the power of data and digital, where you can see that you can double the number of people under treatment, and we tripled the blood pressure control rates in a very short time of implementation. 1 year of implementation, and you triple that control rate, that translates in a lot of people's lives saved. In fact, it translates in about 13 to 15% less strokes in the population in 1 year time. So it's very, very efficient. And the success is thanks to the power of data, because without that data, we wouldn't have been able to really set the proper targets together with the authorities. We wouldn't have been able to monitor progress of the different interventions or readjust the interventions as they were necessary according to the real-time data. And it really creates a mindset shift in the way that health systems are managed or are reoriented. So that's really a beautiful example of how the power of data and then the use of the analytics on those data can help policymakers get better results.
Now, I want to zoom in on, you mentioned that acronym and what each letter stands for, and the I being intersectoral. And so speaking of that, I want to zoom in on one of the partnerships that the Novartis Foundation is behind, which I see that you've partnered with Microsoft on the Global Data Collaborative for Cardiovascular Population Health, AI for Better Hearts. So can you just tell us a little bit more about that partnership in particular? What are its goals, what challenges may lie ahead, and how it fits into the larger context of that I, intersectoral, and how the Novartis Foundation seeks partners in this space?
Yeah, this is a really exciting new partnership we have launched, the Global Data Collaborative for Cardiovascular Population Health, with Microsoft and attracting many other partners as well now. The goal or the aspiration of that partnership is really to access and analyze as many data as possible with big data analytics to develop these AI-driven insights for policymakers and providers or patients themselves to make better decisions for their own health. So if you can help policymakers identify which groups in the populations are at highest risk for acute events, for example, or which kind of groups are really suffering from a lack of access in that or this domain, that's really helpful for policymakers. So that's the goal of the data collaborative. And it's different from existing data collaboratives on cardiovascular disease, because the existing ones, they mainly look at how you bring innovations or game-changing therapies from the bench to the bedside, as they call it, from the R&D to the bed of the patient. And we look at the next phase, from how you go from the bedside to the population level side. And that is pretty unique. So we are convinced that this is a real unmet need in the world, because policymakers, unfortunately, still have to use a lot of their personal opinions in making decisions about population health interventions. And if you look at the example I gave before in the cardio model, where when you give the real-time data in the hands of the decision makers, the results shift drastically in a very short time. So that's why we believe in the power of this data collaborative, and it will be an open source repository of cardiovascular data. We will leave the data in situ where they are in a country, for example, because that's one of the challenges, to get data out of a country and getting them all together in one single place. That's not really the goal of the data collaborative. Really to use the power of machine learning to do federated learning, as we say, with analytics in situ on the data that is available. So that will provide insights. But on the other hand, it has, as you said rightly so, very many challenges. So very often we see that data sits in these isolated silos, not talking to each other, not interoperable between a hospital system or a primary healthcare system. or data are not usable because when they were collected, the patients were not asked to use that data for other reasons than the one they were collected for. So that's a very frequent problem as well. And lastly, you need to have the trust of the people to give their data. And that means you need very strong privacy and security measures in the data collaborative to be able to provide that trust for the people who will use it and for the people who provide their data.
Well, you mentioned this lack of interoperability as a real challenge. And I wonder, any other challenges you want to share in terms of public and private sector players looking to share data? Tough decisions that have to be made, trade-offs that have to be considered, and strategies that are emerging to overcome those challenges?
Yeah, there's a lot of trade-offs to be considered, and the main strategies for overcoming the privacy issue is really to use the top tools that a company like Microsoft can bring to anonymize data, I would say, to use differential privacy, for example, something that is really very solid that no one can recognize in the patient data. But also the fact that the public sector owns data is, it's not so easy to make that available then to do the analytics on it with data scientists sitting in a private sector organization. So you have to have that good relationship up front if you want to build that. And lastly, I also think that given that there's so many different solutions out there, and specifically in the field of digital technology, it's very important that the government keeps the coordination amongst the partners in their hands, or the local authorities, at least it can be the city authority or anyone, but that they have the coordination. Otherwise, we end up with a similarly fragmented landscape as what we saw in the digital space before. And with AI, we cannot allow that to happen.
Exactly. Learn from mistakes as well as what worked, and avoid that fragmented landscape. So any final thoughts or calls to action for this highly engaged group? How do we make sure that this potential turning point actually is a turning point and a real game changer?
I think the real call to global action for that, to make it a game changer and to make sure that we get to our real health systems in the world, is that everyone who plays in the field of health and care has to accept to adopt a data-driven mindset, because that's what's going to make the difference. If we do that, you can have tremendously better results if you understand what is going on under your hands, instead of waiting on reports that come 2 years later. You need to use the real-time data. So that mindset shift is quite a shift in many countries, for example, but that is going to be the biggest call to action I would love to do through this channel. Thank you, Catherine.
Thank you so much, Anne. And I know you said that, it's important to have a data-driven mindset, also a data-driven strategy, because the way to avoid this fragmented landscape of solutions like we saw in the digital revolution is to have a strategy. I know that's something you've shared before. And so it's really helpful to learn about your strategy, and looking forward to following that moving forward. And now we're going to transition to a session where you all will hear more about the role of essential diagnostics in strengthening primary care. Thank you, Anne.
Thank you. Bye-bye, Catherine.